Nick. Is there anything new coming on the horizon with regards to treatment for menopause?
Yes, one of the frustrating things about COVID is our clinical trial program has been brought to a temporary halt.
Right.
We want to restart it. So in terms of hormone therapy, we are in the process of looking at a type of estrogen called estetrol, which is manufactured by the fetal liver.
Mm-hmm.
So it's produced during pregnancy.
Mm-hmm.
And this particular type of estrogen appears to have similar benefits to normal sort of adult human estrogen, estradiol, but in laboratory studies suggests that it has a protective effect on breast cells. So it prevents the formation of tumors. So it potentially could have a protective effect against breast cancer risk.
Wow.
So that's going to be a very exciting new molecule to research, not only from the point of view of alleviation of symptoms, but also potentially having a breast protective effect. The other studies that we've been involved with are with a group of non-hormonal products called the neurokinin receptor antagonists.
I remember you talking about that, yeah.
Yeah, so these are molecules which block the receptors in the central nervous system, which we think are leading to the generation of hot flushes and sweats. And by doing so, I think providing an option potentially for women who have, malignancies, hormone receptor positive malignancies like breast cancer, for instance. And unlike the other preparations that we've used in the past, which are non-hormonal, that have taken the edge of symptoms and given us some relief, this really is up there with HRT in terms of the degree of effectiveness.
Fantastic.
I think in terms of the brave new world, and the thing that will enable us to truly individualize treatment, it's got to be pharmacogenetics. So looking at someone's genetic blueprint, and then designing a recipe, a hormone therapy recipe, precisely according to their specific blueprint. And then there won't be all this sort of, we'll start with lower doses and work up. We'll know exactly what dosage and what treatments to use in each individual case.
Well, I shall look forward to speaking to you more about that. Significantly in the future, I suspect.
So will I.